everyone. We are here, Mary, Shannon, and Joe, just to chat about medical marijuana and a little bit about kind of an evening cannabis talk. We were going to do a Facebook Live, and unfortunately, we just decided this was a little bit of a better platform. And we are missing two of our hosts, but we're going to have a lot of these in the future. We're going to be very interactive in the comments and kind of encourage everyone to give us your feedback. If you want to learn something more about cannabis and about the medical marijuana program, feel free to ask us some questions. That's why we're here. And hopefully we can do this a lot more often. But just to give a brief introduction, my name is Mary Wardeball, and I'm Director of Community Outreach of Organic Remedies. And then Shannon.
Hi everyone, my name's Shannon. I'm a pharmacist with Organic Remedies, and I currently work at our Organic Remedies McKnight location on Pittsburgh.
Hello, my name's Joe. I'm the Director of Scheduling and Dispensary Relations for Compassionate Certification Centers. And you can find me in all of our locations and going in and out of dispensaries and all over.
You're all over the place. And then one thing I think is really important just for us to kind of talk about, just so you as a viewer can feel connected to us as speakers, is just how we got into this industry and kind of what our day-to-day life looks like in the cannabis industry. My cannabis journey started in March of 2018. So just creeping onto my 4-year anniversary with Organic Remedies and the medical marijuana program. Cannabis has completely changed my life. In 2016, I was about 85 pounds. I was the sickest I've ever been in my life, and I was having a lot of issues in my GI tract, went through a lot of specialized doctors. It was on a laundry list of medication, and I was having the worst quality of my life that I've ever had, and it really just happened overnight. So until, my health that I took ever so for granted, just because I've never was sick before. I never thought that I would, ever be talking about medical cannabis, and something like this, really took full control of my life and has saved my life. So I have the utmost patience when it comes to working one-on-one with someone to help them get their life back and just experience the wellness that I experience today. That is why I'm so passionate with education on the program. I think it's so important, and there is somewhat of a disconnect between, if a patient really is just starting new and doesn't really know where to go. I think it's very lucky that they're in Pennsylvania, because we do have people like us for every step of the way just to help them through. And whenever I first started at Organic Remedies, I was a patient care specialist working at the Chambersburg dispensary location. We now soon will have 6 dispensary locations: Chambersburg, Enola, York, Pittsburgh and on McKnight Road, Paoli, Pennsylvania, and then we will also soon have one in Bethel Park as well. So we're all over the state now, and education is definitely still needed 4 years later. I love talking about the science behind the stigma, the available products, the different types of forms, and I love, going to an old folks home and a police department and talking about the funky strain names and actually why they are so beneficial. And, it's definitely not something to be afraid of. I want people to talk about cannabis like it's just a cup of coffee, and, lose the stigma of it for sure. So the education side is definitely my passion. And then Shannon, if you want to tell us a little bit about yourself.
Absolutely. Thank you for sharing, Mary. So I honestly never really thought I was going into the cannabis industry. So what inspired this and incited this is I was awarded the company's first scholarship my second year of pharmacy school. And after that, I called Eric, the president of the company, to thank him for that, and how I really looked up to him as a pharmacist. And through that, I just kept seeing him through a series of serendipitous events at different pharmacy conferences. And my year I was about to graduate, the February before they restricted visitor access, he invited me to come see the Enola location. I spent a whole day there and absolutely fell in love with the patient interaction and the one-on-one patient relationship that you can develop. After that, he invited me in for an interview. The rest is history. I've been with the company ever since 2019, working at the Enola location, and in the last few months, the McKnight location in Pittsburgh.
Awesome.
And Joe?
Thank you.
So I started my patient care journey working at an assisted living facility for about 4 or 5 years. But I always had an interest in cannabis and the benefits of cannabis. So basically from there, I just went out, kind of educated myself. I went to different seminars, different events, cannabis cups, all those sorts of things, different meetings, normal meetings. And luckily I ran into the founders of CCC. And luckily I was able to link up with a very great organization.
That's awesome, Joe. Thank you. So a little bit about our topics today. We're just going to talk about the overview of the medical marijuana program, a bit of the science behind the stigma, and then how to get your card and some DOH hurdles that you may run into. And we'll start just with the overview of the program. So April 17th, 2016, Governor Tom Wolf signed Act 16, which is the Medical Marijuana Act. And this act is very specific and structured to encourage a medicinalized approach on the medical marijuana program, which I think is very unique. And, you know, in today's world, it is definitely needed. It's a very controlled program as well, and it's ran by professionals that truly care. And it seems like in any avenue, whether if you're talking to a patient care specialist or a pharmacist or a certifying physician or one of your certified specialists as well, it's incredible the amount of passion that we have for this, you know, and it's definitely, I just think, one of the best laid out programs. And I know that there's a lot of things that could potentially change for the better for sure. But I think so far, just for 4 years in, sometimes I have to remind myself that it's still so new and we really have came so far. Pennsylvania was the 24th state to legalize medical marijuana. And Pennsylvania is also one of the very few states that whenever you walk into a dispensary, there's specific roles for the pharmacists and other healthcare providers too, to really give you both perspectives of medicine. And speaking for myself, that's really what saved my life and put me in remission, kind of, you know, not just going cold turkey off of the other, you know, medications I was on for my inflammatory bout, and, you know, not knowing that it's not an overnight switch and it's going to take using a full spectrum of, you know, wellness and naturopathic medicine to heal me. And that's something that doesn't happen overnight. So it took a lot of patience and trust. And I see that a lot with other patients I speak with too. Organic Remedies is also very unique in the sense we are partnered with Philadelphia College of Osteopathic Medicine. So we are also conducting research on the medical marijuana program, which is incredible. And I can't wait to see where, you know, in 3, 5, 10 years that that data ends up. Another thing that the law requires is a very extensive seed to sale tracking. So from when the plant goes in the ground at our greenhouse to the patient, you know, in the patient's hand in the container, there is a lot and batch number that it is getting lab tested as well. So it's a very controlled and safe program, which is very unique and lucky for Pennsylvania. There's also specialized training for physicians, pharmacists, nurse practitioners, physician assistants regarding the latest scientific research on medical marijuana. And then when you're working with a patient care specialist one-on-one to get an idea of what, you know, would be best for you to decide, you can also then go to our pharmacist as well, or your certifying physician to get, you know, more of an educated recommendation, just depending on your needs and, you know, what recommendation may work for you. And then patients must be qualified for medical marijuana card based on past medical history. So there are 23 approved conditions in Pennsylvania. One thing I really like to stress is that it is just a recommendation and not a prescription. We hear that a lot, you know, saying that, you know, they're prescribed medical marijuana, but really it's just a recommendation from your physician saying that this may be suitable for what condition you're suffering from. On the Department of Health website, there is a list of the 23 serious medical conditions that are approved. I encourage everyone to get very familiar with the Department of Health website, and, you know, someone like myself, Shannon, and Joe can always help you navigate this as well. One of the most common ones that we do see is anxiety disorder. And then the other disorders are anything from if you're just managing something that is chronic, just managing pain, or if you're treating inflammatory disorders as well. Another very common condition that we see, and the most common one actually, is severe chronic or intractable pain. With this being such a vague diagnosis, it can be anything, if the patient is just suffering from pain or if they're on other medication, and, depending on what their goals are, they will work one-on-one with their physician or pharmacist to see if their goal is to, hopefully someday lower that medication, or, altering any of their doses, depending on what their goals are being a medical marijuana patient. And I always try to encourage patients to really try to communicate with not only your patient care specialist, but also your pharmacist and physician, so we can give you the best recommendation that we can. That can be anything from, I tried something like an oil or, tincture capsule, and it didn't work, I give up. It's definitely something that you want to communicate with us, so, we can help you if you need to alter anything, or if you need to just to take a relook. It could be even something that a strain or a specific type of strain just might not have been suitable for you, or even the dosing as well. So I always say, don't give up in the beginning. It's definitely, keep it like a little journal of, your own medical marijuana journal, to kind of keep an idea of what's working best for you. And I always say you are, definitely your own expert, and you know your body best. So if you know that something may not be working, we will definitely listen to that and help you any way you can. When other therapeutic options have been exhausted, a physician may specify a dosage form, so a tablet, lotion, oil, tincture, or a specific strain, or even a certain dose, or a physician may leave the specifics of dispensing entirely up to the pharmacist. But Joan, you can probably speak on this, that generally this is definitely a patient-to-patient case, and it's not just a general answer.
Well, the reason cannabis works so well too is because of that. It's so customizable. Everybody is so different on what they need, what's going to help them, what ratio is going to help them, specific strain. And the pharmacists just have a lot more great experience seeing these patients every single day, what's working, what they tried last time, and seeing other patients with similar conditions and being kind of able to help figure out from there. We guide them with the CBD, but we always recommend speaking with a pharmacist, just because they are very, very well versed in knowing what works, what products are on hand, and how they're going to help.
And one thing too, and I know Shannon could definitely agree with this, and Joe too, looking at the menu, it is changing constantly. So if something isn't working often, or if we're out of something that you may want, there's often another avenue that you can always use, another product that could be even better or equally as beneficial. And then Shannon, if you want to talk a little bit about the science behind the stigma and why cannabis works for everyone, even all of these different conditions, and then a little bit about the pharmacy and patient connection as well.
Absolutely, Mary. Thank you so much. And yes, this is absolutely what made me fall in love with this job, is that patient interaction. So when we have patients coming to us through our consultation for the very first time, it can be very overwhelming when you look at that menu. For example, currently right now, there's almost 600 products. And so I walk them through that menu. And prior to that, I ask them, what are your symptoms? What are your goals of therapy? I go through some general information about the medication. And looking at the menu, we then personalize their products for that visit and start to develop a treatment plan for them, because it can change. And one aspect is the qualities of the product that we're choosing and the dosing. And another another is how that patient responds to the medication. And so our bodies have this endocannabinoid system, which is how the medication works. Currently, our body produces our own natural endocannabinoids. And so that includes 2-AG and anandamide. And so cannabis can closely resemble that, especially the THC molecule. And it interacts with the CB1 and the CB2 receptors. CB1 receptors are primarily found in the nervous system, and CB2 primarily within the immune system. And the mechanism of action, how it kind of works, THC is a partial agonist at the CB receptor, where CBD is a little more different. It undergoes negative allosteric modification. I won't get into too much of the medical jargon, but it can create conformational change at the CB receptor. It's not entirely fully understood, but it's been theorized that these two cannabinoids really do closely synergize, and they enhance each other's therapeutic properties. And CBD can also kind of help reduce the psychoactivity of THC. So I really try to go into detail about the potential effects of both THC and CBD. And with your medical marijuana card, you have access to our dispensaries, and everything in our dispensaries do have that THC, which does have potential side effects. Nothing has ever produced a fatal overdose, of course, but THC does produce that euphoria, the psychoactivity, but it can also produce, analgesic, muscle relaxing, sleep inducing, and appetite stimulation effects. CBD, on the other hand, is non-psychoactive, but it can produce anti-inflammatory, neuroprotective, anxiolytic, antispasmodic relief. So it can be really, it's really fascinating how the cannabis works in our bodies and how it's been able to produce these benefits to our patients. And the success stories are what make me love my job. Hearing the feedback from the patients, months after. I had one patient that told me that her pain went from a 10 to a 2, after following up with her and finding the best regimen for her. With anxiety, it's definitely unique as well. THC can sometimes it can actually provoke anxiety, but the goal here is to find the right dose where it is actually anxiolytic and reduces that anxiety. So sometimes CBD helps balance that out as well. And on top of THC and CBD, there's a whole host of other cannabinoids as well found within the medical cannabis plant. And so these, for example, include CBN, which is really known for its sedative properties, and THCV, which actually has been shown to have appetite suppressing properties. A question I get asked a lot is, what is THCA? And so THCA and CBDA are the acidic precursors, and they're the acidic forms of THC, and that's how it's naturally present in the plant. And through heat activation, it decarboxylate that into THC. And there's a special formula, to know exactly the percentage of THC. It's 87.7% of that plus the THC. But aside from that, you have all these other components found in the plant, specifically the terpenes, which Mary, if you wanted to kind of go into a little bit more detail about that.
Yeah, one of my favorite things to do when I'm giving a presentation to someone that's completely new to cannabis is I set a little clementine on everyone's table before things are all virtual. And I, tell everyone to close their eyes and take the clementine in front of them and bust open the peel and take a big inhale. And that bright, citrusy, beautiful scent is a example of a terpene that is also found in oranges and lemons. There's specific terpenes that are found in cannabis, and many that they're still finding, but it's the natural essential oil in all plant material. And this can really help control your effects and help it control the dose, and the depending on what strain, not only the effects, but also the taste and the smell of it too. So when something has a really stunky smell or something smells very like, lemons or like lavender, all of those are specific to what terpenes are, showing most in the plant. And that's when finding out what you like and what's best for you can become really fun and kind of like your own little science experiment, because you really start getting an idea of what's going to work best for you when you start focusing on that part of things and looking forward to products too. You're like, wow, this has 3% of limonene in it, or this has 2% of pinene, and all of these promote different effects as well. So it can be really fun to try and figure out and navigate what's going to work best for you with something like terpenes.
Absolutely. And so with that is kind of what we've theorized as the entourage effect is what really seems to provide the benefit to our patients, that synergy. It's what seems to make cannabis from the plant a little bit better than marinol, which is synthesized THC. And going off of that, we then have a ton of different dosage forms coming out of the plant. You have the actual plant itself being presented as flower or dry leaf, which in the state of Pennsylvania is meant to be vaporized. We also have our vape pens, we have concentrates, we have oral products. Unfortunately, no edibles because of the potential dangers of accidentally eating too much of a cookie. We have tinctures, capsules, and extracts instead, as well as topicals that you can apply for more localized pain relief, and by far definitely the safest option. And I almost recommend it to every pain patient because surprisingly it's really effective, and like I said, again, it's really safe. So it's always a potential add-on therapy. The inhaled forms, I will say that everything, especially organic remedies products, they're third-party tested 3 times. There's no additives or preservatives, no vitamin E acetate, no polyethylene glycol, which you actually can see in some unregulated CBD vapes and products out there. So I really do trust the products in our dispensary. I also go through all the dosing for the tinctures and the capsules because a 5 milligram capsule is definitely going to have a different effect from a 50 milligram capsule. And a lot of patients might think they try one capsule or one tincture and think that all the tinctures or all the capsules don't work for them, when that's not necessarily the case. I also try to, individualize each patient's therapy based on their current situation with their current medication and their current other health conditions. I try to look at if they have any, heart issues going on, if they're taking any medications that might have interactions, for example, warfarin or amphetamines or central nervous system depressants. I look at, whether or not they are pregnant or looking into pregnancy, lung disease, risk of falls for our elderly population. And I also try to cover a little bit of the legal constraints as well. So I really try to go through a comprehensive overview and just give as much information as the patient needs. We also do this, entirely free of charge. So you can always call your dispensary, call me if you have any questions, is what I always tell my patients.
Thanks so much, Shannon. And then Joe. Joe is definitely the master at the beginning steps, before you have your card and you're thinking, could this be an option for me? And there's sometimes some Department of Health hurdles and frequently asked questions that you are definitely an expert of helping us navigate those hurdles. So
Yes, so one of the big main things that potential patients might kind of scare them off is they think they might get into some sort of database. This is all completely protected by HIPAA. No one knows you have your medical marijuana card. It doesn't show up on background checks, police systems. Your employers can't find out unless you would like to tell your employer. And especially this far along, 4 years later, many jobs and employers have a policy in place at this time. If you have a medical marijuana card, odds are they have a policy in place, whether for it or against it. Most jobs right now, it's looking like, just from what I've seen, do have some sort of a policy in place. And sometimes what they ask for us, they'll send us a letter from their employer. It'll just need filled out by one of our doctors, and we're always happy to do so with that. That's one of the main things. It's all protected by HIPAA. It's just a recommendation from a doctor. From there, you go to the dispensary and you choose what you'd like to do for your treatment plan. Um, Becoming a patient, like Mary said, there's 23 qualifying conditions in PA. We don't need a doctor's permission or a referral, but what we would need is just something that, verifies the condition, qualifying condition. From there, you would give us a call, shoot us an email. You can register right on our website at cccregister.org. And then you're contacted pretty much immediately. We have multiple locations. We have a Butler location, we have a Natrona Heights location, we have an Erie location, and we have a Carlisle location. And Washington. Did I say Washington? We have a Washington one too. And they're all pretty much located within, next to dispensaries. So you'll be able to make 2 trips that day. We do virtual appointments. We have availability on our virtual schedule. But yeah, we'd give you a call. We get you on with our doctor. We just need a photo ID. We need something that verifies one of the qualifying conditions. You choose if you'd like to come into the office, if you would like to do it virtually. Yeah, you have a nice intake with a clinical intake. Your doctor then comes on the line. They go ahead, get you certified. And from there, the card typically takes about a week to come. It could take up to 3 weeks, but usually it comes in about a week or so. And we can help with everything. Registering with the Department of Health can be tricky. We can get you registered with the state. We can help you make the payment to the state after the appointment. By the time you're done with one of our appointments, you shouldn't need to do anything except wait for that card in the mail. We can help obtain records. You name it, we can help you through the process. All you got to do is call, reach out. We'll make sure everything's taken care of on the front end, back end, and in hopes so you can start your cannabis as soon as possible.
Now, one question I wanted to ask you, Joe, just because I get this question a lot from patients that are just starting out. If you had to give like a general estimate of how long is that process going to take from like the moment when, they call you?
Start to finish. Say you called me right now to set up an appointment. I would say, Mary, we just need some kind of document that's going to verify your conditions, send over your photo ID. I get you on the schedule as soon as tomorrow. You could have your card by this time next week, potentially, depending on how quick it takes the card to come in the mail. But instantly, process on the phone, the sign up is maybe 2-3 minutes long. The appointment itself, it depends, it varies. If, same thing probably with the pharmacy consult. Patients have more questions, want to talk, we'll talk to them for as long as they want to talk to us. But typically an appointment's about 15 minutes long. So it's very, very quick process. It's very seamless. And we can help you with any step along the way.
That's awesome. And I think that's one thing that's really, unique to, as well as in the cannabis industry is it's really, if you go to a regular doctor's appointment, you can feel so rushed and that you don't have that same connection that you used to have with like, even a family practitioner or, specialized. I remember sometimes waiting months to get in with this, like a doctor that, I was like, oh, finally I've got in with, this person, they're really going to help me. And I just felt so rushed. And I didn't feel like that same connection. It seems like in the cannabis industry, at least for every step that I've ever had personally and as a patient, and then also with other patients, I mean, we are truly here because we care, all of us, and never feel shy or anything to ask questions or no question is silly. And, it is so much information. It's literally now there's so many products. It's like looking at a diner menu of cannabis. So try and navigate that as like, someone that doesn't work in it every day. Even sometimes I remember when I was in the dispensary every day, if I had a weekend off or something, I'd come back and be like, what the heck is this? So like, I can't imagine, someone that doesn't look at the menu every day or is, in the vault, seeing the products all the time. So never feel silly for asking certain questions or, if this is going to help. But I always say too, just for my own personal recommendation, online is such a hub of information. Everyone loves to give, what's helped them and this strain's perfect for this. And I always say everyone, and I know we've all said this, but everyone is so different, and it's such an individualized approach to wellness. So just know if something works for Joe or Shannon, it might not work for me and my, in my lifestyle and my, conditions. So, and vice versa. So not that I wouldn't want to try it if you guys loved it, but it could just give me a different effect, but that's nothing to get discouraged over.
It can seem very overwhelming, the process, especially the stigma in the past, how it's been illegal. It takes a lot for maybe a patient just to pick up the phone and call to inquire. So that's why we really take pride in making sure we give them all the information they need. We will help them with every single step of the process, because it can be overwhelming and scary. It's new. It's, definitely an alternative to what patients are used to forever. So it can seem overwhelming, but everybody you'll come across will help you. Dispensaries will help you. Everyone on our team will help you. There's plenty of help. You don't need to know nothing about anything. Just what we've seen success from year to year from a patient coming back to get recertified is amazing. You name a condition or you name an age, we've seen a full 360 with that patient, and they're doing better than ever. So it's definitely worth, giving a shot.
I think that's the perfect way to sum it up is we're here to help.
Yep.
We all are.
Yep. And please, anyone watching this, if you've made it this far and if you have any questions, feel free to discuss it in the comments. We will definitely be active on that. Also, through Facebook, and we all also have Instagram as well for Organic Remedies and CCC. So we're happy to be, active any way we can online to help communicate any questions that you have. And hopefully we can have another session here soon with some physicians involved to get their perspectives of, what's it like being a physician in, the medical marijuana world. And then also talking about the history of cannabis versus today. And then, where we may see it in like 5 or 10 years, just to kind of get some fun discussion going on. But we are definitely listening in the comments. So if anyone has any feedback, please feel free to comment and ask any questions and give some suggestions on topics. This can always be a virtual thing, or, as the weather gets warmer, fingers crossed, we can have something in person, and just to express our gratitude to the patient population and, just kind of, spread some excitement in the medical marijuana industry. And, with COVID and all the times are changing, it can be, sometimes winter blues and everything can get someone down. So I can't wait for it to be warmer weather and us to get out there and, really help, lower the stigma and, just enjoy the process for sure. But thank you so much, Shannon and Joe, for joining tonight. And, we were going to get this on Facebook and possibly YouTube as well. So just keep an eye out, and I appreciate everyone's time. Thank you.
Thank you for having us.
Thank you, Shannon. Thank you, Mary.
Thanks.